Let's go now to Dr. Gordon Self. He's the Chief Missions and Ethics Officer of Covenant Health in Alberta. Dr. Self, thank you for being with us. You guys have had quite a learning curve on the demand for assisted death, haven't you?
That's correct, Lorna.
You made headlines in Covenant Health, not only because you have the largest footprint of healthcare in Alberta, but one of your patients was turned away for euthanasia. In fact, an hour before she expected to have her life taken, she was wheeled outside in her wheelchair, had her assessment done outside the Covenant Health facility, and eventually she was euthanized a month later in a different hospital. What did you learn from the trauma of seeing someone wheeled out into the cold who actually had wanted to stay inside and be killed?
Well, there was a lot of that we've learned through that. One is that often in healthcare, things happen at a rapid pace, and there's always a risk of miscommunication. And so that was one of the things that we learned very quickly, is that there was just a compounding sequence of events where we had information and then different information. And as a result of that, an adverse event occurred. That family was initially offered the opportunity to have the assessment provided on site, and then we had some conflicting information. And regrettably, we reversed that decision. It's something that we took responsibility for, and that we learned from that, and we put in steps to ensure that that would never happen again.
But
so
we've
learned a lot.
It has triggered quite an awareness. In fact, last we checked, 37 Albertans transferred out of faith-based healthcare, so they would be able to choose the timing and the way of their death. It all brings up this big question about, can Catholic hospitals have conscience rights? Are the conscience rights of an organization, of a healthcare facility, the same as a person, as an individual?
That's a question that comes up a lot, Lorna, and I think about, if we have this sense of your own personal conscience, sometimes people have characterized it almost humorously as like a devil or an angel on one's shoulder, and most people wouldn't think of it like that. They would think about, what are some of the core beliefs and values that you hold personally? What are things that sort of that you draw on in terms of scripture, in terms of theological teachings, etc., and also our ongoing dialogue and conversations with other people. That's what forms our conscience on a personal level. And if we have that understanding of conscience, then how would that be any different than an institution that also has a coherent set of policies and practices? It's informed by a mission and a values, that we have policies that help us to make sure that our decision making is in line with that.
Okay, but Dr. Self, the problem is your policies and conscience as Catholic healthcare providers, huge Catholic healthcare providers, is very different from the public. So how do we, here you are running 17 hospitals and care facilities in Alberta, a third of the palliative care beds, you receive public funds. Why should your facility be exempt from medical assistance in dying?
Well, we know that the issue of medical assistance in dying is a very polarized issue. It's a very divisive issue, and that within our organization, you'd see a microcosm of our larger society, of people in support and people who are against it, and same with our patient population. So as long as we're looking at balancing those values, at the end of the day, it's about people getting safe and timely access to medical assistance in dying. We don't provide every service. We don't do heart surgery, for example. We're not funded for certain services, including medical assistance in dying. But when a patient is requesting that, as long as they have access, and we work very effectively with Alberta Health Services, they have a very good model that allows objecting facilities like Covenant Health to be able to work very seamlessly with them to ensure that a patient who's requesting made gets access to
Okay,
that.
so you are a referring agency then. That's part of Covenant's approach.
Well, we don't refer. The way it's set up in Alberta Health Services, that they have a third-party navigational model.
The one
So
person
we would,
navigating all of that. You've
yeah,
left a lot of good information in writing on the Covenant Health website. Thank you for joining this complicated education. Thank you, Dr. Self.